Hi, I'm Ruth McDermott Levy. I am a faculty and co-director at the Mid-Atlantic Center for Children's Health and the Environment at Villanova University's M. Louise Fitzpatrick College of Nursing. And I'm going to talk to you today about how to stay healthy in the United States. This program is funded by the U.S. Center for Disease Control and Prevention and the United States Environmental Protection Agency. The information that is contained in this program should not be used as a substitute for medical care and advice for your child. You should reach out to your child's primary care provider, and that would be the same for you as an adult. There may be variations in treatment that your provider may recommend based on individual facts and circumstances related to you. This program is also presented by the National AIDS Service Center through the Refugee Health Promotion funding from the Office of Refugee Resettlement. So again, we welcome you to this program. The Mid-Atlantic Center for Children's Health and the Environment addresses environmental risks and exposures to people who are planning on having a family and and pregnant women, and then for children from birth to 18 years of age. If you are an adult and have environmental health questions, you certainly can contact us and we can direct you to the proper groups. We cover Pennsylvania, Virginia, Delaware, Maryland, West Virginia, and the District of Columbia. That we are considered Region 3 in the United States. And as you can see on this map of the United States, there are 9 other pediatric environmental health specialty units. So if someone you know lives outside of the Philadelphia area and in beyond Region 3, you can direct them to the other regions. And if they can't find them, they can certainly contact us and we can help them connect to the region where they live. To stay healthy, there are basic things that you need to do. You need to eat healthy foods, you need to get exercise and get enough sleep, and also you need to find ways to manage your stress. As far as healthy foods, the first thing we typically think of is fruits and vegetables. And as you can see from this picture from a market, that the variety of colors are really a way to think about how to get fruits and vegetables. We all have our favorites, but if you have more variety in your colors, you get more variety in the vitamins and minerals that are available to you. And so we recommend that you do try to eat fresh fruits as much as possible and fresh vegetables. And I'm going to, on the next slide, show how to consider the diversity of food that you might eat. In the United States, we use a program called My Healthy Plate, and it divides the types of foods and how much you should get of each of those foods. All of these foods, including fruits, vegetables, grains, and protein, and dairy products, are part of a healthy diet that can help keep your body healthy and, in the case of a child, maintain their growth. So when we think about vegetables, you can see fruits and vegetables are half of your plate. Half of your diet should be fruits and vegetables. And you can see from the breakdown, you should really have more vegetables than fruit. Fruit does contain sugars. It does also have important vitamins. So you just want to limit them a little bit because of the sugar content. And even though it is natural sugars, it adds calories. So when we think about vegetables, certainly salad is a way to include vegetables, and then things like carrots, tomatoes, broccoli, Brussels sprouts, cabbage. There's so many choices in vegetables. You can eat them raw or you can eat them cooked. It is ideal to buy fresh fruits and vegetables when you're not able to purchase them. The next best healthy option would be frozen, and if possible, avoid canned fruits and vegetables. And I know that's not always possible, but they do contain more sodium or salt and more sugar, especially when canned fruits. And so we don't need that extra sugar. On the other side of the plate, you have your grains, ideally more whole grains that are not processed. And so things like oats, um, pastas, rice, and whole grain bread. So the darker color of breads, the browns are dark brown bread, are healthier because they have more whole grains. In the United States, unfortunately, we have a lot of processed food, and so the white, really soft, fluffy bread tends to have, it just has calories and doesn't really have much nutritional value. So that's what we want to do with grains. For proteins, which are really important for keeping our organs healthy and also the developing body. Protein is also responsible for helping us sleep, and we'll get to that. But examples of healthy proteins are poultry, such as chicken and turkey. And then fish is also has a lot of healthy protein. It is okay to have beef, but it tends to be fattier. So beef no more than once a week would be ideal. For people who don't care to eat meats, they can eat eggs or tofu, and nuts have protein. And so you're able to have a balanced diet with that. And then you can see the circle out to the side represents a beverage, but it would be dairy. So you can get your dairy from cows, from milk, yogurt, or cheese. They are the highest amount of dairy. With milk and yogurt, ideally go for the lower fat milks and yogurt. And cheese does have more fat, so that's something to think about as far as limiting, but it is very tasty. So I eat cheese myself. Also, when you think about yogurt, it is better to have the plain yogurts as opposed to the yogurts that have fruit in them, because there tends to be a lot of extra calories. If you want to add fruit to your yogurt, it's better to just use fresh fruit, because there's like syrup in the fruited yogurt. You also need to make sure you're well hydrated and get a lot of fluids. There is some fluid in the food we eat, but you also need, the best way to get fluids in your body is through water. And fruit juices do tend to contain a lot of sugar, so you do want to limit those. And so ideally water is the best way to go. They say that on average, adults should have about 2.5 to 3 liters of water a day, and it depends on your body size. It also depends on how much you're sweating, and if you're outdoors a lot in the warm summer months, you would need more water. The guidelines that I give people is really just look at the color of their urine or the color of their pee. So when you go to the bathroom, check the color of that's left in the bowl of your urine. It should be a very pale yellow. If it is getting more darker yellow or a tan color, you're not drinking enough. And so that's a reminder of you need to drink more water. Certainly, if you feel thirsty, make sure you drink water. As you may have seen in the United States, people walk around with water bottles. It's not uncommon to do that. So that's something for you to think about is, have a reusable water bottle that you can just fill up at home, and then you're not buying water when you're out too. So it's a money saver. So exercise is another way to maintain your health. And when you think about exercise, you can think about what you can do to maintain your exercise. And so there are examples of exercise that you can do. And I want you to think of examples for yourself. And I'm really sorry we're not in the same room where we can discuss this. But some examples that come to mind for me are walking. So during the daylight hours, and you do want to make sure you're in a safe environment. So talk to your neighbors of where are safe places to walk. In Philadelphia, most streets have sidewalks, so that does keep you off the road and it makes you safe, but you want to make sure the neighborhood is safe as well. But getting out and walking with your family, walking to work if you're able, walking to the store is a way to get your work done, the things you need to do, but at the same time, you're getting exercise. You can also run or jog, and this photograph shows things you can do with your family and make it a family fun activity. You can also join a team sport, whether it's what we call a pickup game where people are just gathering and playing a game, or there are a lot of teams that you can join for adults. So, you can decide on how organized you want that to be. Going to the park, Philadelphia has a lot of parks throughout the city. We have a very extensive park system. And so you can go to, parks that are more open or parks that have some hills that you're climbing and getting your heart rate up if you're able to tolerate that. And so that is a good way to challenge yourself and maintain your health. Also, think about your day. I said you could walk to work or walk to the store, but think about if you work in a building that has several floors and you have to go up to the other floors. Think about taking the stairs instead of the elevator. Now, if you have to go up 34 floors, that's quite a bit, but you could walk up to maybe the third or fourth floor and then take the elevator the rest of the way. And think about including that. I know myself at work, I always just take the stairs instead of the elevator to get as much exercise as possible. And then also, surprisingly, and it's a good thing to know, that cleaning the house also has noted to burn calories. So, light housekeeping, not so much, but if you're doing a lot of sweeping with the vacuum back and forth, or even with a broom, that is a way of getting exercise. So think about how you can incorporate this into your day, different activities to keep your bones and joints moving, help reduce stress, and it doesn't feel like it's a extra activity if you make it part of your day. It also helps improve sleep, getting exercise. So sleep is very important. We've all had the experience of not getting a good night's sleep, and you just kind of drag yourself around. You may not feel mentally clear. And that's really because sleep is restorative. So while you're sleeping, your body is healing. And so it prepares you for the next day. So sleep is very important. Ideally, adults should get anywhere from 7 to 9 hours of sleep. On average, it's 8 hours. And then look around in your environment of where you sleep. Is there too much light, and do you need shades? Think about that. Do you find it too noisy, and so do you need earplugs or perhaps some soft music to help you relax and fall asleep? And so think about all of the things that you need to accommodate having a good night's sleep. And the last thing I'm going to say about sleep is that you need to be sure, or to assure that you get a good night's sleep and you routinely fall asleep easy. It is best that you go to sleep at the same time every night and then wake up around the same time every day. I know sometimes when you have a day off, that night you may want to stay up a little bit later and catch some program on TV or do something with your family. And I do the same thing, but it really can disturb your rhythm of sleep. And so ideally, I know myself, if I'm in bed by 10 o'clock, I'm up by 6 and I feel much fresher and ready to go than when I stay up really late to watch some TV program. So, if you're having problems sleeping, try that first, or going to bed the same time every night. So as I said, stress influences our health as well. And so there's ways that we can manage stress. And some of those ways are talking to a friend, and sometimes just laughing with a friend can help reduce stress. But sharing with a trusted friend some of the things that are bothering you can also help manage your stress. There are moments during the day that I can feel overwhelmed. And what I've found is if I stop and take some deep breaths, it just helps my body feel better. And it actually it helps reduce the stress hormones by stopping and taking some deep breaths. So it's okay to pause during the day and do that. Exercise is a great stress reducer. We had some examples, there's others, bike riding, there's a variety of things you can do to help kind of burn that anxious energy and reduce your stress. If you are interested in yoga and moving your body through different positions, that can be helpful. You can go to yoga classes, but you can also get them online, YouTube. Online, you can get people doing yoga and you can follow them. Listening to music can help reduce people's stress if it's music they enjoy. Some people find writing or journaling is a valuable way to reduce their stress. And so you can see, you do which one works for you. Sitting down to write would not reduce my stress. It might actually make me more stressed. So, but for some people, it's helpful. Meditation, and you can see this gentleman meditating, and it looks like he's in a park. So you can meditate anywhere. You can meditate on the bus as long as you don't miss your bus stop. And the same is true for prayer. Prayer is very helpful for people to manage stress, and you can do that anywhere as well. If you find that stress is interfering with your life, or you're feeling increasingly anxious, you need to talk to a professional if the other strategies aren't working. And so if that, again, becomes a problem for you managing, and you feel stressed all the time, it is not, there's no bad thoughts of people who go to professional help in the United States. As a matter of fact, it's very common that people will talk to either a social worker or a psychologist. If you need that kind of help, talk to somebody at the Nationality Service Center and they can help advise you with who to speak to. When you're not feeling well, one of the first things you want to do is stop and think of the causes. Are you eating right? Are you being really stressed? Are you getting enough sleep? But also you may start feeling sick. So were you around anyone who had a cold, or did you eat something that disagreed with you? So again, you need to be your own health professional as well, or your health provider, and think about what is going on with you. We have what's known as over-the-counter medications. And they are medications that treat minor symptoms that you can manage at home and not require going to a doctor or a nurse practitioner. In the United States, we have what's known as pharmacies. In other countries, they may be called chemists. And we have different names of pharmacies. So different chains. So CVS, Rite Aid, and Walgreens are common chains that are in Philadelphia of pharmacies that you can go to. Also, grocery stores such as Acme or Cousins may have these over-the-counter medications as well, and convenience stores, little stores on the corner, may have some of these over-the-counter medications. As I said, they typically take care of minor symptoms such as headache or fever or cold problems. So we have those medications. And if you're not sure what to get, you can always ask the pharmacist at a pharmacy. The important thing with over-the-counter medications is you need to take them as directed on the label. And it usually has, you can see these medications are in boxes. So inside there's usually instructions that come out on paper, but also they're on the back of the bottle that is inside the box. If you're not able to read the label, ask the pharmacist or ask someone who is fluent in English who can help translate what it says on the label. On the back of a medication label, there's standard things that are there. The active ingredient, and that's the chemical or medicine that is going to address, for an example, a fever. How to use it. So it says, you would take this medication for whatever the ailment it expects to treat. So I'll use acetaminophen as an example. That would be for a headache, fever, or mild pain would be uses. The directions, so how frequently you take it, how many tablets you take. The inactive ingredients are the things that are not part of the medication, but that are part of the pill. So it may be the binder things that hold the medication together, or the outside coating. They are not active ingredients for the medication. There will be warnings on the label of who should not take it or when to contact your healthcare provider. And then there could be other information, you know, just things like, you know, if you have a problem, contact your physician, or something like that. And then the questions and comments are usually a phone number. So if you have additional questions or concerns, there's a phone number or a way to contact the distributor of the medication. To determine if you have a fever, you need to take a temperature, and you need a thermometer for that. In the United States, we use a digital thermometer, and they can be purchased at a pharmacy, or sometimes at grocery stores as well, in the aisle that has the over-the-counter medications in a grocery store. And you can see it gives the reading, and right above it, there's a button, that oval button. That's how you turn it on. You place the tip of it, the silver end, the small end, under your tongue, and close your mouth around it. And then you hold it in place until it beeps, which would indicate that it's done measuring. And then you would remove it and read what it says. A normal temperature in the United States, we use Fahrenheit, and so it's 98.6. I know that seems very high if you're used to Celsius. The equivalent would be 37 degrees Celsius. Most providers are used to Fahrenheit. You could tell them the Celsius reading, because you can change that thermometer. There's instructions inside of how to change it to Celsius if you choose to do that. For fever or pain, we typically use Tylenol, which is acetaminophen, or ibuprofen, and the brand name of that is Motrin. And you can see there's samples of what the bottles might look like. It's, again, very important that you take the correct dose and the correct frequency. And so here's a chart that shows you how frequent you would take acetaminophen. You can see there's different types of acetaminophen. So you can have regular strength, which is the most commonly used acetaminophen, extra strength, which is stronger, and then extended release, which lasts longer time. And so, so then it tells you the amount of the dose in this chart, and then how frequently. So for an example, if you just had a headache, you more than likely would take the regular acetaminophen, 35 milligrams, and 2 pills every 4 to 6 hours. And then you can look at the other examples of how frequently and how many pills you take. For ibuprofen, it tends to be a 200 milligram tablet, and you can take 1 pill every 4 to 6 hours, but you may also take 2 pills. So if it depends. If you've never taken it before, I would recommend taking just 1, but it can go as high as 2, and you can see that on the explanation. For children, I always remind people children are not small adults. Their organs are still developing. All of their organs are still developing. And of course, we know they're growing rapidly. So we see a lot of changes from the time someone is born until they're 18 years old. So for babies, 3 months or younger, so that's a baby 12 weeks old or younger, they must be evaluated by a healthcare provider first. And so we don't give them acetaminophen or ibuprofen for fever unless we've been instructed by the healthcare provider. That is the only time we give it. And to take a temperature of an infant, so that's up to 12 months old, you can take it either rectally, which would be gently sliding the thermometer into the rectum or the bottom, and you want to use a different thermometer. So there would be just the thermometer you use for rectal temperatures. You don't use the same one that the family would be putting in their mouth. A temperature of 100.4 or 38 degrees Celsius would be considered a fever. The other option is to put the thermometer under their arm, and you could use the one that they put under the mouth for under the arm. And that one would be 99 degrees Fahrenheit or 37.2 degrees Celsius would be considered a fever. With the acetaminophen, we take the medication again only from 0 to 3 months or up to 12 weeks old. You need to talk to the healthcare provider. But for babies, they put the medication in a like in a syringe, a tube with a plunger, and here is the dose. So it's a very small dose. It's marked on the plunger, the tube, of 1 to 2.5 milliliters for a baby if it's approved by the pediatrician. And then as the child gets older, so from 4 to 11 months, it's 2.5 milligrams. And for 12 to 23 months, so up to before they turn 2 years old, it's 3.75 milligrams. So you can see that of how they take it. And they just place it into their mouth and gently squeeze it in there. The Tylenol, as the child gets older, would take it in a cup and sip it, or they can have chewable tablets. Both the liquid and the chewable tablets are a little bit sweet, and so the child may want them later too, thinking it's juice or something, so, or candy. So when you're done with the medication, giving it to the child, you need to put it in a safe place that's out of reach for the child, because these are medications, even though they're available without a prescription, and you can just buy them, in a grocery store or at a pharmacy. They are medications, and too much can cause problems. So you definitely want to put them in a safe place. These are the doses for older children, and you can see the doses go up, and with either liquid or the tablets, the chewable tablets. And these instructions also are within the packaging for when you buy these. So you can see the instructions, but if you're in doubt, either talk to the pharmacist or talk to your healthcare provider, because too much can be a problem. If someone has a cough or cold, there's cold medications. And so one is an expectorant that helps loosen up the congestion in the chest, and so so people can cough it up and get it out. And then the other one is a cough suppressant. If they're coughing too much and it's irritating their throat, or it's irritating sleep, they can have a cough suppressant. If you're not sure which type to get, again, you can talk to the pharmacist and explain the symptoms, and they can direct you. And again, read the directions on the label. We have a phenomenon in the Philadelphia area of a lot of pollen in the spring and in early summer. And this is coming from the plants. And so it leaves, you can see this dust on the car, it leaves this yellow dust everywhere. And so it can cause a minor allergic reaction with people. It's not anything life-threatening, but we refer to it as hay fever. And it's a common occurrence. It's not anything that you need to run to an emergency room about, but it can be very annoying. And so what can happen is people can have a runny nose or itchy eyes or congestion. They can be sneezing or having sinus pressure. It is not caused by a virus, and there is no fever. And so it's important that we keep in mind, again, thinking about, why am I feeling this way and what is going on? And if you're feeling like this, it may not be a cold. It could just be this irritant that is causing a minor allergic reaction with you. And again, with this, you can take some over-the-counter medications for this, antihistamines and things. And again, this may be the time to talk to a pharmacist of what they'd recommend to take. And this is another image of how to consider whether it's hay fever or not. And again, you can have sinus pressure. One of the things I didn't mention is you can have kind of dark circles under your eyes, and that is from kind of the swelling or puffiness you may get because of this reaction to the pollen. So there are times you definitely want to see your healthcare provider, and they are when symptoms do not resolve in a normal course. And so if you're, if we're told this can last 5 days and it's day 8 and you're still not feeling well, you need to call your healthcare provider. And that's just an example. If you're still not feeling well, or if your symptoms have gotten worse, or the over-the-counter medications have not helped, then it's okay to call them and maybe make an appointment. And also, if you just feel like you're not feeling right and things aren't really helping, you can call to see if you can see the healthcare provider. And sometimes it may just be a telephone call, and they may manage it over the phone, or they may say they want you to come in. If you need more care than that, again, contact the healthcare provider. There may be instances where you would go to the emergency department, and we're going to talk about those. But those services are covered by your health insurance. So don't let the concern about paying for it stop you. If you need to go to the hospital, definitely go to the hospital. The healthcare providers or professionals that you may see at the hospital are nurses. They are probably the largest group of healthcare providers you would see. And they are people that have had 4 years of college education or university education. And they can give medications, give injections, develop a plan of care for you, and work collaboratively with the rest of the healthcare team. Nurse practitioners are nurses who have had additional higher education, and they can diagnose and prescribe some medications. The same is true for physician's assistants. They have 4 years of college and additional higher education, and they can also diagnose and prescribe some medications. Medical doctors are either MDs or DOs. MD is a medical doctor. A DO is a doctor of osteopathic medicine. They have had 4 years of university and 4 years of medical education in addition to training after their medical education. They can prescribe medications, diagnose, and do invasive procedures such as surgery. So, how do you determine if you have an emergency? And these are just examples. But if someone's having difficulty breathing, that is an emergency. If someone is unconscious and they were conscious before and suddenly they're unconscious, that's an emergency. Severe chest pain, choking is an emergency. If they can't clear their airway and not able to breathe. Any injury to the eyes are considered emergency. Injury to the head or spine is also an emergency, and they need to be evaluated. Change in mental status. So if someone is talking to you and they're very clear, and then all of a sudden things don't make sense, and what they're saying doesn't make sense, it's considered an emergency because there's something going on neurologically to make them behave that way, and it needs to be evaluated. Any severe pain where people, are bent over in pain in their abdomen, in their head or chest, definitely needs to be evaluated. So that would be considered an emergency. And bleeding that would not stop. So I'm sure there are other things, fractured bones. I mean, there's many things that would be considered an emergency, but these are just kind of the common ones. When there is an emergency, if you're at home and you experience some of the things on the list or other things that you consider an emergency, you would dial 911, and that would go to the Philadelphia emergency system. What you need to do is tell them what is going on. So in other words, you can say, I'm here with my grandmother and she was perfectly fine, but now she doesn't make sense and now she's unconscious. Tell them again what happened, and then tell them where you are. So you would give them your address. For an example, you could say, I live at 438 Market Street in Philadelphia, and please come, to that address. You can also, at that time, if you're with someone, you can ask them to go to the door to let them in, or open the door, so that, depends on where you live to make the decision of what's the right thing to do. So that's what you do. And I also recommend on your refrigerator, you put your address, because if an emergency ever happens, you're going to be very anxious and not thinking clearly. So you can just read your address to them. Or if there's somebody who's not lives in the home and doesn't know your address that's visiting, they can read them. So let's review what we've just learned. Gada is 2 months old, so she's 9 weeks, and she's acting irritable and feels warm. Her mother. So what should her mother do? So let's think about this. So we've got a baby who's less than 3 months old, and she feels warm. So the mother needs to take the temperature to find out the baby's temperature. And then if the child has a fever, she needs to call the healthcare provider, right? We don't give aspirin or we don't give Tylenol or Motrin to the baby, because unless we've talked to the healthcare provider. So that's what the mother should do. If the child's still acting irritable and doesn't have a fever, it's okay for the mother to call the healthcare provider too, to find out what to do. They're used to getting questions, so that's fine. So again, this is the chart, remembering that at 0 to 3 months, if the provider tells her to take Tylenol, this is the amount that you would give, the 1.25 in the syringe, and squirt it in the baby's mouth very slowly so the baby can swallow it. And Nembe and his wife Sarah have moved to the United States, and Nembe is feeling sick the night before, and he went to bed early. Sarah got up early in the morning to make breakfast. Nembe is usually up getting ready for work. Sarah went to the bedroom to get Nembe, but he's still in bed. Sarah knocked on the door, but there was no answer. When Sarah went into the room, Nembe was wheezing and would not wake up. So what should Sarah do? So we want to stop and think. I'm sure Sarah is very anxious. So what Sarah should do, because this is an emergency, somebody's not waking up, they're unconscious and they're wheezing. So it seems that he's having a problem breathing. So Sarah should call 911. She should tell them what's going on, that her husband is wheezing and will not wake up. She can't wake him up, and give the address of where she lives. Purnima is 34 years old. She has a headache from reading all afternoon. She wanted to buy some medicine for a headache. So again, stop and think. We have an idea of why she has the headache from reading all afternoon. It doesn't sound like it's a severe headache, so it doesn't sound like it's an emergency. So we need to figure out what she should get. And typically for a headache, you would take either Motrin, which is ibuprofen, or Tylenol, which is acetaminophen. Again, the generic is fine to buy as well. So that's what she should do. And we can figure out how much she should take by looking at the bottle. And so for ibuprofen, which is Motrin, she can take 1 tablet every 4 to 6 hours. If it was a strong headache, she could take 2. But since we'll assume that Purnima has never taken ibuprofen before, so just take 1 to see how that goes. It should usually do the trick for a mild headache. Or she can take acetaminophen. Doesn't sound like it's a really strong headache, so a regular strength should do it. And in this case, she'd take 2 325 milligram pills, and she'd only take those 2 pills every 4 to 6 hours. And usually with a mild headache, the 1 dose would do it. So just take the 2 pills and that should take care of it. So thank you so much. Wishing you the best of health, and welcome to the United States.